hopefully we'll save some time so that there will be some time for questions at the very end. Let's see. Okay. I'm left-handed, maybe that's my problem. Okay, that works? Okay. So my name's Camille Nebeker. Sorry. I'm the principal investigator of a project called the Connected and Open Research Ethics. We call it the CORE for short. And it's supported by the Robert Wood Johnson Foundation. And we launched it in November of 2015. And over on the right-hand side, you can see our Twitter accounts and a hashtag that we're using, and I'll explain what the MISST ethics is in just a few moments. I also want to turn on my timer so I can make sure I'm not going over. So, okay, maybe it. Okay, I don't know how to advance it. Not happening in the traditional ways. Does anybody?
I just click it.
Okay.
You just tell me what to do.
Okay, perfect. Thank you so much. So the objectives for today, I want to talk about the changing landscape of 21st century research, how it's changing, morphing, similar with healthcare, identify the key ethical challenges that are introduced by new methods and new tools that are being used for research purposes, and to enlist you as stakeholders in the ecosystem to help shape the ethics in the digital age. So the MISST acronym comes from different technologies that are being used in research, primarily in behavioral medicine, which is where I got introduced to this topic. So a colleague of mine was supported by the National Institutes of Health, and she was using a wearable camera, a GPS, an accelerometer, to identify how people behave in the wild. So up until this point in time, and she started doing this about 2013 was the first grant that she got from the National Institutes of Health to see how people operate in their free living environment. So as an alternative to self-report, as an alternative to watching people in a lab setting, she wanted to pervasively sense what they did every day. So she recruited people from, or she wanted to recruit people from Craigslist and ask them to wear a camera. Anybody notice that I was wearing something that looks a little different? So this is a wearable camera. It faces outward. If it was turned on, would you want to give consent? How many of you would want to consent to be captured on my camera? Okay. So keep that in mind, because that was an issue that the Institutional Review Board had. All of a sudden, you became the research record, but you're not research participants. But this is an important tool to see. They can see where I'm active. This GPS tells them where I am. The accelerometer, and these tools are so much more sophisticated now. You can do it on your phone, basically. But this was, 3 years ago. They could see where I'm active, what it looks like, how much I'm active, and with the idea of personalized medicine, if I have a goal to achieve a certain number of steps, to be a certain, a heart rate, all of these things can be tailored to me if they know how I behave in my day-to-day life. So they called me up. They've got the mobile imaging, pervasive sensing, social media I'll get to in a second, and location tracking. So they submit their protocol to the IRB, and lo and behold, they got held up a little bit. Let's see what's next. So what happened is the IRB was completely unfamiliar with this. They said, your study's great, looks good, just take out that camera and just go about your business. That's all good. Well, they said this is a really big study, NIH is supporting it, we have an R01, and this is a major instrument of our observational study. So they went back and forth a few times. They asked me to come and talk to them because I've been an IRB member for 20 years now, and I'm in behavioral medicine, and my work is in research ethics. That's what I do. So I said, show me what you're doing, show me what the data looks like, and I looked at this and I thought, you know what? The IRB has never seen this kind of research before. They're missing things that are risky, like not thinking that location tracking is sensitive, or that it needs protection, or that there should be certain standards for data security. So these were kind of like, but they wanted to protect you. And you're not a research participant, so you kind of are out of the purview of an IRB, but they wanted to protect you. And to protect you, they said you have to take out any image of a non-participant that you capture. Well, this happened in another institution. That person didn't have the funding to do that themselves, so they outsourced it to Mechanical Turk. Okay, so all of a sudden, something that the IRB thinks is reducing a risk completely elevates it, okay? So what I'm saying here is that these tools, these methods are new. There's new ethical challenges, and IRBs are not quite prepared for it. So as I'm mentioning, this can happen. These people are being measured 24/7. It's not exclusive to academia anymore. Now we've got Google, we've got Facebook, we've got Intel doing research. Those organizations don't accept federal money to do their research, so they don't have the same rules that we have in the academic environment. Academic folks are bound by the federal regulations. Facebook industry, they're not. The other thing is that we can know everything at a granular level. How many of you were in the session on mental health last session? We can know everything at a granular level, more than we ever knew we could know, and we can't promise anonymity any longer. Using location tracking, we can pretty much infer where a person is. Using Twitter, because it's geotagged, we can pretty much know within a small radius who has HIV. So it's getting to the point of that kind of granularity. So what this is doing is informed consent is not informed to begin with. That's already a broken process. But what it's doing is it's putting a little bit more burden on us to figure out how do we inform people. First of all, people typically don't know what research is. They don't know what this technology is about, and they don't really know what their data looks like. And then that varies by culture. It varies by SES, so it's already a complicated issue that we need to start thinking about how do we do that better. We also, so an IRB, their charge is to qualify and quantify the probability and magnitude of harm and of benefit. We have no empirical evidence to help them make those decisions. We also are assuming that they're technically savvy, that they have some sense of how to secure data, and that's putting an awful lot of new responsibilities on a body that's not familiar with this kind of research. We also have Bycatch. So this is one example. People from Craigslist, they enter a study, they agree to wear this stuff for a week. Now they're advised not to join the study if they're clinicians. They're told take it off if you're going to be putting your PIN number in the bank. Don't wear it to the bathroom. If your family's getting undressed, take it off. You can see all the things that you can capture, right, inadvertently. So we catch people. And now there's audio recording. So people are being audio recorded to happiness. How do I sound if I'm happy? How do I sound if I'm sad? So that's just another example of the kind of challenges. And then data management. I work with behavioral scientists. They're not clinicians. They're not recruiting patients. They're recruiting people. These people are not diagnosed with anything. They just want to observe healthy people in their everyday life. So all of this data that they're collecting does not fall under any HIPAA protection, and we don't have guidelines to drive that bus. So, Robert Wood Johnson Foundation had observed that many of their grantees were asking for no-cost extensions. That's because they couldn't get IRB approval. It was taking them 8 to 9 months, even longer, because when an IRB sees something new, and I am an IRB member, so I'm one of these, it's a conservative response. We don't know how to do it, so let's overprotect, which creates access to research barriers. So Robert Wood Johnson Foundation says we've got to get our grantees moving a little bit more quickly. Let's figure out how to redesign the IRB. What would it look like if it were responsive to new technologies? So up there, it's a design thinking approach, human-centered design, design thinking. We had people from our relatively new D school, design school, help us conduct a workshop where this is the process. You think of big ideas, you narrow those down, you blow them up again. We came up, we were like outside the box. What would an ethics review process look like? And we had the analogy, the learning health system. What's a learning ethics system look like? What if we make a mistake? What if we give more autonomy to researchers to self-regulate? What if, and those were the prompts of our questions, what if we were to inform informed consent? What would it look like? So these are the questions. How might we do that? How could we empower researchers? How could we learn from our efforts to protect participants so that we actually did something meaningful? How do we get feedback from participants who have been in our studies to tell us whether or not informed consent was really meaningful? How could we improve what that looks like so that we know that we're actually engaging in a meaningful conversation and it's all part of we're all in this together. So the whole idea was improvement. And we questioned, do we keep the existing system? As if we have a choice, but we're thinking, we've got to do something different. We've got to do something different. Do we transition to a new model? Do we create a hybrid? Can we design a system that's responsive to both academic and corporate worlds? Y'all probably remember the Facebook study. Yes? No? No? So Facebook is doing A/B testing on us all the time. They want to know what kind of feeds you like, what kind of buttons you push, what kind of ads you respond to. They do this all the time. Well, Jeff Hancock, who was at Cornell at the time, studies emotional contagion. He's actually here. He's at Stanford now. So they said to Jeff, we'd like to work with you. He is an academic, so he published what Facebook would never typically publish. And it talked about how hundreds of thousands of Facebook users their feeds were manipulated. Some of them didn't get the happier feeds that they normally would have, and they wanted to see, does this influence how people communicate? And Facebook users did not like that. They didn't feel as though they had consented, so it kind of blew up. And it basically told us that people do want to consent to participate in research. They want to know, they want to consent, they want to give their permission. And Facebook now, just 2 months ago, published their ethics review process in a law journal. So that incident prompted Facebook to do something they didn't have to do. And now Microsoft and Intel, they're all starting to think about, well, we don't have to. We don't want to become like the academic institutions, but we need to do something. So I went to the Robert Wood Johnson Foundation because I already knew this was a problem. I had gone to the NIH and I had asked them, can you support us finding a new way of looking at research ethically? And I actually got scored. And it was a decent score. And I submitted it again. This is 3 years ago, so this is new. And I had a third reviewer who couldn't understand why we were doing any of this. So my score got worse. But I had a proposal in place, and I said to the Robert Wood Johnson Foundation, who supports the Health Data Exploration Project, they were there for a meeting in San Diego, and there was a lot of tension in the room because there are people doing it yourself. There are people from industry that won't partner with academics because of the burden of the IRB system. There's a lot of tensions going on as we move into this new frontier, a lot of new problems. And the tension was palpable, and I was the IRB person in the room who said, you know what, either we bring them along or it's going to be a major problem. So I asked, would you help me create a pilot so that we can see if a new system would work? So these are the stakeholders that I see in the system, but in actuality, this is a small group. So we have the people designing the technologies. We have the people who participate in research studies. We have the folks designing the research that want to answer the questions, and the IRBs who are there to protect human subjects and to make sure studies are designed ethically and carried out responsibly. So I asked them, could we have enough money to just look at 2 of our stakeholders? I want to introduce this idea to IRB people, get them, find out, do you think you even need help? Would you like help? Can you do this? There are 6,000 IRBs in the US. Right now, this kind of research makes up 1% of NIH's budget. So they don't know how to do this yet. And they're getting it incrementally. And any of you in here that have submitted to an IRB know that you can submit the very same thing to the very same committee and you're going to get different answers because they're human and they're doing their best, but it's not consistent. So I went to a meeting last year where the IRB people congregate, and we did focus groups and we collected data and we learned that they really do want help. And if we created a place, they would come to it. The same thing is true for the researchers. So what they told us is they want to crowdsource guidelines, they want to have access to information, they want to innovate the informed consent process, they want to engage people in the process so that they know that what they're doing is the right thing to do, and create standards for sharing and securing personal health information. As I mentioned, it's not covered under HIPAA. So the core platform is what we've created. We've created a web-based space where stakeholders, and again, those are my 2 stakeholders, but right now we already have close to 200 people who have signed on to our network. They're privacy experts, they're participants, they are IRB people, they're researchers, and the researchers are pretty diverse. They're computer scientists, they're behavioral scientists, and they're clinicians. So we've created a forum where you can come and ask questions and have somebody with expertise answer those questions. A resource library where people are taking pieces of their protocols, pieces of their consent language, they're tagging them, they're uploading them. So if you start doing a study with a wearable camera and nobody in your place has ever seen one of these before, you can go here and find out how are people doing this and what's worked for their IRB. You can see which IRB has approved this language. So you have all this information available to you and a network of experts who you can call on to say, I see you're doing this, can you help me out? So again, this is a collaboratory that we've created to support mobile health stakeholders, Q&A forum, resource library, and a network. And basically, for the first time, we're bringing together researchers, regulators, ethics board members, and the other stakeholders. And what I'm asking you to do, as people who have a vested interest in doing this right, is to take a look at our website and join the core network. Take a look at and we're in beta testing. I mean, we're early into this, but we need the community to participate in helping it build and grow and develop. So this is our card. It has our tutorial, 3-minute tutorial, access to the network. You sign in, jump on board, take a look around, see what you think, give us feedback. And I have cards with me in case you want an actual card. And, oops, this was actually our, you can go ahead, that was our proposal, which in this lighting you can't really see, but it looks pretty cool when it's lit up right. Yeah, that's good. And so, again, it's the connected and open research ethics. We're based at UC San Diego. We're based there, but already we're global. And I'm really excited about that. Our makeup is about 40% IRB people, 40% researchers, 20% split out over privacy experts, technologists, and people. And the people are the people that I'm really excited about, because we're going to ask them to start vetting these consent documents. Thumbs up, thumbs down. So we have a rating system. And this is intended to be dynamic. So when things become obsolete, like the Palm Pilot, it'll go down to the bottom. We won't see it anymore. But the things that we don't know about yet, they'll be on our forum. People will start talking about them. So I think I'm pretty close to right on time, 20 minutes. So thank you so much. And if there's any questions, I can answer a question or two before I pass it on to Anne. We're curious about whether or not what we're developing would be useful to corporations, individual, like the person. Yeah, we're definitely interested in, are you talking about consumers or participants? Yeah, so an interesting thing is I'm wearing a Garmin VivoFit right now. So these things that I had on, they're all commercial grade, research grade. The researcher takes this data, puts it in their computer. It doesn't have a middleman. They have the data. When a VivoFit is used as a research tool, no different than when Fitbit, the research already now has to go through the terms and conditions and the privacy agreements that may conflict with a consent form. So we're thinking about consumers as well as patients/participants. I think our focus can move into a clinical area, but my containment right now is research, because that's kind of what I know and where I see problems as we need to test these things to make sure they're working, right? We're going to need people to participate. So cards are up here. I'm hoping, so right now I have 152 people in the network. I'm hoping that you will sign up, and by the end of the day, we'll have closer to 200.